Does the thought of visiting the dentist raise your fear factor off the chart? And you're not alone if that happens. Dr. Martin's going to be on Fear Factor soon and going to no, that's not true. He's going to join us this morning on Virginia This Morning. Welcome, sir.
Thanks.
So you're not going to be on Fear Factor. We're just going to talk about the fear and how it factors into people not going to the dentist.
That's right.
Do you find that most adults had some bad experience along the line some way or somewhere, or a big majority?
I would say that a large percentage of the population has a hard time with it, has a hard time going to a dentist. That's an accurate statement.
Yeah.
There's some that are really very phobic. Other people just don't have an easy time of it. About a quarter of the population, it doesn't bother them.
Yeah.
The rest of them does.
Okay, well, let's talk about this fear factor and how people should kind of change their thinking, because obviously dentistry has come a long ways in the last several years.
Oh, of course.
Big changes.
Big changes. And you know, people have fears based upon an experience they actually had as a small child. Now, logically, it doesn't make sense to them that they still have this fear, but it's an emotional imprint on them. So we understand that. Okay, so it takes another emotional imprint to overcome that one. Of course, there also is the discomfort when even a person comes in and says, "You ever had a bad experience going to this?" They say, "No, but I'm still anxious. I feel like a 2-year-old in your chair." Okay, so this is just some of the emotional things that we have to deal with.
So, what methods are we using to help people get past
Well, first of all, we're going to listen to everything they've got to say about it. You know, there's a certain catharsis, a certain relief if someone listens to what you have to say and understands you because of it. A second thing is that we're going to do some certain things to desensitize the experience. We remove smells, for example, in the office. We have a certain look of the office. We act a certain way because we know people are more comfortable with that. The third thing is that we ask them, what is it that you didn't like? We don't want to do that.
Just if they can actually nail it down,
exactly,
you probably avoid that.
Exactly.
You know, when people come in and you say you do all of these things, and I've been to your place of business, and it's a beautiful setting. Does just the physical appearance of the lobby and all of that, does that make a difference? I would think
it can for a lot of people.
Yeah.
It can for a lot of people.
Pretty relaxing.
Having an aesthetic space to be in other words, a space that's feel comfortable to be in, helps you feel better about anywhere you go. And so the office was designed for that.
All right. You always bring your before and afters, and we always like to take a look at those. And people that have been to see you.
Right.
And this before and after is a little interesting to me because the before doesn't look terrible to me. Of course, I'm not the one that got the work done, but of course the after looks fantastic.
Right. This lady wasn't happy with the various colors of the teeth, and that there was some, turns and misshapes and some things like that. So she actually liked the fact that we could straighten them out, create a nice arch, and create a white smile all the way back,
and a nice line,
to it. So that's what she liked.
There's definitely a difference, but wow, she's got to be proud of that after shot too.
Absolutely true.
All right, we're always happy to have Dr. Charles Martin.